Hello, ladies and gentlemen. So we're coming now to the sixth lecture in the series of psychology. This is probably the more important or most important lecture in this series because it will summarize what we've learned so far and will give you some tips of how to apply and understand what to do with your patients. Because that's the most important thing is we're learning all this to be able to use it with our patients. So today we're going to talk about mental disorders, psychological and medical therapies. Now I'm not going to go into a lot of details of the medical therapies because that's the area of psychiatrists. These are doctors who study postgraduate as specialists in psychiatry. And they have access to a wide array of medicines nowadays. But we're going to concentrate more on understanding the mental disorders and how you can help these people. Now, you're not going to become psychologists, but you are going to be the person who's going to go with a needle towards a patient. You need to understand what's going on the other side of this needle. It's not an arm or anywhere else in the body, but it is a full human being that you are working with. So first of all, what is a mental disorder? So it's a disorder, right? What is it? It's an illness. It can be an illness. It's or a condition. It's in the mind. So it's a condition of the mind, and it affects these things that go on in the mind: thoughts, feelings, and behavior. And we had the lecture about social behavior, so it does influence how this person behaves in society. And these disorders do prevent these people from having a balanced, happy life, normal life, what we would consider normal. Now, you may not believe this, but actually a lot of people do have mental disorders at some stage or in their lives. So, there is a basic distinction, as I said, is between psychological and psychiatric conditions. Psychiatric, I would say, conditions are mainly those treated by psychiatrists, which usually have some medicine involved with other therapies. Psychological are those who usually get seen by psychologists, and there is no medicine involved here. But sometimes it's a mixture of both. So you have both in a person. I'm going to show you, don't be afraid, this is a long list and it's a massive list of what disorders are there out there. But I'm going to give you an idea about bits about the most important ones. Some of these are easy to understand once you've got it. So I started with the Stockholm Syndrome. The Stockholm Syndrome is a psychological condition recognized after a kidnapping in Stockholm. And basically what it is that someone kidnaps a person, and then after a while, within that, the person kidnapped starts to have feelings for the kidnapper. I think the best example of this is the story and the film The Beauty and the Beast, where the beauty, the princess or the lady, starts to love the person who abducted her or took her from her parents' house. And that's what it is, basically. Autism spectrum disorders. And why do we call them spectrum? Because there is a variety of presentations with this condition. Autism spectrum disorders is a variety of levels. Some are severe, some are less severe. And what it is, it's a complex, this is a kind of nowadays recognized also as a learning difficulty. And it's people who are born with it. You do not get it. You seem to have, you seem to get it, not kind of like other conditions uh, via an external effect, but actually you were born with it. And it's a complex developmental condition, and it involves challenges, I would say, in social interaction. Now, and speech and nonverbal communication. So you find that these people, at a variety um, of degrees, have kind of like an abnormal social behavior. Um, One of them is, for example, being, while very intelligent, but socially awkward. So you find them that they kind of like have their heads down, they concentrate, but they can paint amazing paintings and pictures with a lot of details that normal people wouldn't be able to do. But at the same time, when they do want to interact with other human beings, they have a lot of difficulty. They are not comfortable. So they are usually into themselves. And some of them are so severe that they just keep moving around. And there is a kind of like a connection to the ADHD condition, which is attention deficit and hyperactivity disorder. So you have kind of like these sometimes intertwined together. And these are people, usually we see them in children, where they have no attention, as it says, attention deficit. So you tell them, do this or don't do that, and they are just moving around. Now, I have seen them sometimes in my practice where they just keep touching things, playing with things, breaking things, and you tell them, please sit down, and they just don't listen. They have no attention. They don't listen to you, but they have something in their mind and they keep going on with that, whatever they have in their mind. So I'll show you something here. There's a man called Wiltshire, and he paints the London skyline in such a detail that is just amazing. Small, tiny details, and you need to get very close to these handmade paintings to realize how detailed these are. And these are massive, massive size. And he does them from memory. He just looks and then goes with that. It's not like copying. This is not copying. This is from memory. So to give you an idea about the size, this is the size of this painting, and it's all from memory, as you can see. So this is an autistic person who seems to have fun in this ingenious way of painting in details. Bipolar disorder is a condition where these people have extreme mood changes, kind of like ups and downs. Very happy, very sad, melancholic, happy, and energy levels go on up and down. So the behavior and the energy levels go up and down. And they have kind of like types of manic bipolars and depressive ones. So the depressives are when they are very low and manic when they are very high. So you look at the manic depressive. So suddenly they are very happy and they are laughing and you don't even know why, and they don't even know why. And suddenly afterwards, after a short while, they're kind of like depressed and sitting there quiet and you don't even know, and they don't even know why. So kind of like these variations. We've talked about eating disorders uh, as you know from the in the other lecture, like Pika and the So there's anorexia nervosa, um, bulimia nervosa, anorexia, you don't eat, bulimia, you eat and you vomit it. There's the binge eating disorder, there's the pica, as I said, and there's the rumination disorder, so they eat and then they vomit and they play around with it in their mouth. And there's also the avoidance or restrictive mouth food intake disorder, which is seen frequently in children. And there's also depression. A lot of people have that, and there's a few conditions that are associated with that. It's not unusual for a lot of people, or most of us, to have some depression at some stage in our lives, whether it is by losing through death or disease someone close to us or having a separation. So it's kind of like it's a prolonged feeling of helplessness, hopelessness, and sad. Helpless, hopeless, and sad. And what we consider clinical if it goes beyond 2 weeks. So, what is normal is that you're just sad for a while. When it goes beyond 2 weeks, it becomes clinical. And it sometimes needs, in those cases, some assistance, frequently with medicine. Now, postpartum depression is a special one, which happens sometimes to ladies after they get a baby. So after the birth of their baby, they get a special type of depression, which is very dangerous if not treated soon and well, because it may cause harm to the baby through the mother, and that's been proven. Okay. Then there is the OCD, which some of you have actually talked about in some of the presentations, which is obsessive compulsive disorder. It is obsessive and compulsive. And obsessive is this, it's recurrent unwanted thoughts. You keep thinking about something. One of those is that, for example, we see is you find that you need to repeat something or you need to recheck something. Frequently, we see that is people who go out of the house, but they keep coming back and rechecking everything, the light, electricity. They have this feeling that they have forgotten something or something will happen. There is counting again and again. There is hand washing. They wash and wash again. Bakurdi, we could call it amali. We call it sometimes amali, but it's mainly for hand washing and things like that. But you recheck things and you clean, over clean, and clean and clean and clean. I mean, everything is clean. You still disinfect and clean extra. And you have these thoughts in your mind, and you want to get rid of them from these obsessive minds, and you have a compulsion to do something, these rituals. Panic disorders are, for no reason, people who get anxious and panicky, and they kind of like hyperventilate like that. They are hyperventilating, they are very anxious, lasts about 10 minutes for no reason. There is no reason to have a panic attack, usually. So one of the easiest way to treat that is by asking them to blow into an empty bag. Because the more they hyperventilate, the less the CO2 sensor in the brainstem gets signals of, and the brain thinks that they need to breathe more and more because the sensor is more for CO2 rather than for oxygen levels. And that can cause actually fainting. So panic disorders, you see them for some reason, just someone who panics. Phobias, most people have some kind of phobias. And there's a long list of phobias. Dentists, like me, or spiders, snakes, phobias from heights. There's a lot of phobias, hundreds and hundreds of phobias. Public speaking is phobia. There's a phobia for that. There is phobia from death, for example. There's a lot of phobias. Now, some of it can be debilitating, where people wouldn't fly because they have phobias from flight. And there are people who actually take long train journeys rather than fly because of their phobia. There is also like minor phobias, like kids having fear of darkness or these monsters that might eat them, etc. PTSD, I mentioned that in another lecture as well, is the post-traumatic stress disorder, where people have an event and it causes them stress, which on its own then can cause also depression. Some of the causes for depression is what also causes PTSD, like war, for example, rape, natural disaster, something that happened in Beirut more recently, abuse, sexual or physical, serious accidents. If you have been part of witness to a massive car accident, for example, any other accidents, or air accidents. So it's witnessing it or being within it, and it gives you a mental disorder where you can't function well in society because of fear and the behavior changes. And I see that a lot personally here in Kurdistan. And I see people, which is not surprising after all these wars. These are the painting culture. Other mental disorders are schizophrenia, for example. Schizophrenia is where people may have more than one personality. Dr. Jekyll and Mr. Hyde, for example, is a well-known story. The record is 80 something, 82 personalities in one person, and all different with all kind of features of different people. So one person could have multiple versions of themselves, one evil, one very nice. And these are all well documented. Seasonal affective disorder, people who are just, by the change of weather, can have different moods in the tendency of or near the depressive range. Just coming back to depression here, I mean, there is a lot that is associated and close to it, and a lot of people may suffer from it. There is the major one, which lasts weeks, months, and years, and there's the mild one, which is less severe, but can last years. There's also the adjustment disorders here, where kind of like with the depression, where you have a divorce, you have a breakup, parents, yourself, you've lost your job, financial problems, can also cause you depression with stress, like here. Some people get so far to get suicidal tendencies and start to think about hurting themselves. I'll show you a short video about Tourette's just to get you an idea about how it is. And this develops in childhood.
It feels weird because I'm in control of everything else. Why aren't I in control of that? Why can't I stop myself from doing that?
I have no. With that, every single second, I just feel like kind of funny inside.
We don't yet know exactly why.
Stop doing this. Why can't I stop doing this?
I had a tick like a really loud screeching noise. All the kids would like tell me to stop and just keep staring at me.
Things trigger ticks, and like let's say regional winters, I guess. Like every time you come to the letter P, you'd have to jump like on one foot. Like that.
You feel like a marked man. Tourette's isn't like a whole another person. Like me. I'm a regular kid.
These are the voices of Tourette's.
There, why do you have to make fun of it?
Why are you doing that? That's so annoying. Could you please stop?
All of these young people had the courage to take part in a recent documentary called I Have Tourette's, but Tourette's Doesn't Have Me, which was produced by HBO and the Tourette Syndrome Association. They also had the desire and courage.
Or
So you can see they have some certain behaviors.
Described as simple phonic tics. More complex.
Okay. So it's basically having these special certain sudden movements. They have no control over that. Dissociative disorders are kind of like people who disconnect themselves from the society, thoughts, memories, kind of like all just go away, disassociate from that. Okay? Hypochondria, it's a condition where someone keeps thinking they will get, or they have actually, a disease, an infection. And so they have all the time medicine, antibiotics, other disease, other medicine, because they think that they are going to get ill or they are ill with this or that condition. And so they kind of like misinterpret their normal body sensations. An anxiety disorder is when people are frequently anxious. They are anxious of a lot of what we would consider normal. So they have fear of a lot of things. It's different to phobia. It's different to phobia. Phobia is a condition that prevents people from doing anything. And anxiety is just having an unpleasant feeling. Kind of that they're just, they show themselves like their heart rate is increased, kind of their pulse goes up, and they kind of like shake. They're kind of like, it's a little bit close to panic attacks. But panic attacks isn't something that happens all the time, but these people are anxious all the time. Now we're coming to two items here. Now, pedophilia, we are trying to understand if this is a mental disorder or not, of why some people have a tendency of wanting to have sexual interaction with children or touching children. We think that it's a mental disorder, but we haven't understood it very well, and we do think that it is a choice. Now, in the past, especially in the UK and as well most countries, being a gay or a lesbian was considered a mental disorder, and people were treated with medicine for that. Nowadays, that isn't considered a mental disorder, and we still don't know why and how someone becomes gay or lesbian. We just don't know. There's a lot of theories about it. Now, are these mental conditions serious? The WHO says that 1 in 4 will be affected with one or more of these conditions during their life. Sorry, their life is misspelled. And they say actually, the WHO also says that about 450 million are affected at any moment worldwide. Now, that is a significant portion of the world. You need to think about PTSD and anxiety, many of these conditions that are connected, and depression from all the things that happen in the world, plus all the other problems we all have. Someone who hasn't been paid his salary for multiple months, has no income, well, there is no wonder that this person may get a mental disorder. Can it affect society? Yes, doesn't it? First of all, these individuals will become less productive. They will be less happy with their lives and they will be less interested in doing their jobs well. From time to time, someone who's so depressed and with some major mental illness will take a gun and start shooting at people, which happens all the time in the USA, where it's easy to get a gun. Now, it happens also frequently here. People are angry, have other problems, take a gun out and start shooting each other. And we've heard about these multiple frequently here, where people just for no reason, uh, football match, for example, two brothers each on one side of football match, I think Barcelona and Real Madrid, and one of them goes and shoots the other. And that's just not normal social or psychological behavior. Or the other thing where within, I think, a PUBG game, someone shot the other person in real life after I think they didn't help them in the PUBG game. So you can't see we can't see that all the time in the society. Right, warning signs. How do you have a feeling that there is something wrong here? And I've got a short summary. The warning signs, there's a lot. There's a lot of treatments and a lot of warning signs, but these are the most important. And you can find that you've probably seen someone with these. This person doesn't feel any pleasure in life. They're just not happy. They cry a lot for no reason. They're sitting there, you're sitting with them, and suddenly they start crying. And they don't even know why. They withdraw from other people. You don't see them anymore. They are kind of like somewhere tucked away in a room, and they don't want to come out. Severe anxiety, panic, fear. When you see these are the behaviors that are abnormal. They feel worthless or guilty of something when there is nothing. For example, being guilty for the death of someone when they are not guilty, actually. They just have that feeling. They have big mood swings, like what we said with the manic depressive bipolar, up, down, happy, unhappy, happy, unhappy, sad. Experiencing a change here of sleep and or eating patterns. So suddenly they are not hungry, they have no appetite, they can't sleep well, or the sleep pattern is kind of like erratic, not normal. So these are also signs of a mental condition. They lose interest in any hobbies or any pleasurable habits. So you want to go on a picnic, Sairan, they're not interested. You want to go and do something with them, some activities, some football, going to the gym, absolutely nothing. They just want to sit somewhere, withdrawing from other people and in the room. They have low energy. They're just not interested. They just have no energy. And they may also tell you about voices and images that actually nobody else can hear or see. And I remember I was in a neurosurgical department working there at some time. And I remember going into a room and the patient told me, can you tell those camels to go out? And this person was actually seeing camels in the corner of the room, genuinely, which is a kind of hallucination. Then an anxiety feeling of people are plotting against you. Something is happening, and something is happening back to you because people are planning something against you. And the feeling that you want to harm other people, as I said, with shootings, etc., or people who self-harm. And we see that frequently on the arms, where they start to harm themselves, they want to hurt themselves. I've seen it frequently. Also on the legs, they start taking a knife and just cut, not very deep, but just kind of like at the edge of what I would call pain, that threshold. So I have here very simple diagram here comparing physical illness with a mental illness. Now, for example, diabetes can happen in pancreas or will happen in pancreas, while the mental illness is in brain. Now, as I said, we're not talking about the psychiatric conditions because they will involve multiple transmitters and their deficiencies and changes. So the pancreas in the diabetes produces little or no insulin, while the brain produces too much or not enough of some neurotransmitters. This is when it goes into some psychiatric conditions. Tourette, for example, is also one of those conditions where there is a neurotransmitter which makes these sudden moves, causes these, but we don't know exactly how it works. Diabetes doesn't have a cure, but there is a management with lifestyle and insulin, etc. Again, mental illness doesn't have any cure, but there are treatments if they have psychiatric conditions with some drugs and sometimes with other ways of treatment, which I will describe in a minute. For example, in the US, 18 million have diabetes, but within 2004, 57.7, about 58 million over 18 have a mental illness. So that's a significant portion. Treatments. In general, time, perseverance, and patience. These are the first three that are important. For most mental conditions, we're not talking about the psychiatric ones, you need time, persistence, and patience. Be patient with these people, patience. Give them some time. Time heals. If there was a trauma, if there was death, if there was something, time will heal because we have a good weapon, which is forgetting. We start to forget things, that helps us. And persistence. Keep helping that person until they get back to normal behavior. There's, in addition to that, some type of behavioral therapy and cognitive therapy and some medical, as I said, with medicine, and many other therapy methods, but these are the important ones, behavior and cognitive therapy. I want you to read about these, and we're going to discuss that, as I said, in the free session. I have a long list of films that I would like you to watch at some stage. They are not for the course, but these are interesting films where you can understand more about the psychology and what we've learned so far, and all these things in these films. Have some fun and at the same time learn something. Inside Out is about a girl's mind and how it is working when they move from a city to another city where she doesn't have any friends, and it's a new school, new neighborhood, everything is new. So what's going on in the mind of this young girl? A Beautiful Mind is about John Nash, who developed the game theory for which he received a Nobel Prize. He had schizophrenia, and there was a lot going on in his mind, but he managed to control that at some stage. Good Will Hunting got some Oscars. Beauty and the Beast, as I said, is the Stockholm Syndrome. Rain Man is autism. Regarding Henry is brain injury and a change in personality, the psychology and the change in personality after a brain injury. Reign Over Me is about PTSD. After 9/11, someone in the US gets PTSD from that trauma. Me, myself, and Irene, again, schizophrenia. The Joker, most of us have watched it, which is kind of a combination of manic depressive, bipolar personality. Shutter Island, Hallucinations. The Pursuit of Happiness is not about a condition, but perseverance and how you psychologically can improve yourself. The Sixth Sense is a film about violence, what we mentioned here, in let me see. This is a person who has an anxiety disorder who comes and shoots someone, which is his psychologist, and then there's a child that seems to see dead people, and it's a very interesting film. Don Juan de Marco is someone who has schizophrenia, and he thinks that he is Don Juan de Marco, and a psychologist trying to help him. Very interesting films, actually, very fun. Some of them are old, some of them are newer. And at the end, I need to tell you a few things here. I do think that you could enjoy the course and think of it as a journey. Just enjoy it and think of it as a journey, not as a rigid course. It's not that difficult to pass it. It's more about the journey of learning and self-educating and understanding what's going on in the mind here. Because let's remember and not forget that the main job that you will have later on is taking blood from patients. These patients could have any of these conditions: phobia from needles, and anxiety, panic attacks. You need to know how to help them when they present with these things. Have empathy and understand what's going on. You could start by analyzing those around you. And first of all, and most importantly, analyze yourself, because you will understand more of these conditions and what's going on if you start to analyze yourself. Look at these symptoms we've described today and think about your life and what's going on so far. You've had not a very long conscious life so far. Then you can look at it and understand more about you and those close to you, and then think about it as a journey, as I said. Patients come to you and they need to have the confidence that you will do your best to help them. So empathy is very important, to feel and to put yourself in their position, however condition they have, whether it is one of those childhood conditions, if it's Tourette's. When you see these things, have empathy, understand that these people are not there because they are annoying you, but because they have some problems, and you can help them before you stick a needle into their arms. Thank you very much. And we come to the end of these lectures. And I hope that you've learned something throughout these lectures. I do think that especially the learning and exam lecture could be useful if you tell your friends and relatives about it, those who are going into the 12th year exams. Thank you.